Hello, everyone. My name is Darren, and I am one of the marketing coordinators with BCIT's School of Health Sciences. It is my pleasure to welcome you to the Health Sciences information session for the Environmental Public Health Program. First, I want to say how happy we are to see you all, and thank you for attending our presentation today. And feel free to post any questions or comments into the chat during the presentation, and we will address as many questions as we can near the end of the presentation in the Q&A segment. And if you could please keep your microphone and video turned off until the end of the presentation to reduce connectivity issues and interruptions during the recording, that would be greatly appreciated. And just before we get going with our main presentation, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. So tonight's agenda, we're going to do the welcome and introductions. And then we'll have a quick poll just to find out where everyone is at. We'll watch a environmental public health video, and then we'll do the main presentation and program overviews. We'll have some program advising information, and then we'll get to the Q&A at the end. So just before I introduce Dale, the program head, let's launch a couple of polls. This should not take too long. This will be the last poll. What is not part of an environmental health officer's job description? To inspect food premises, inspect drinking water systems, inspect fish and wildlife habitat, inspect a tattoo parlor, or investigate communicable disease outbreaks. And with that, I'm going to introduce Dale Chen, the program head of Environmental Public Health, and he can let you know how you did on the Environmental Public Health poll, and then we'll proceed with the presentation. So take it away, Dale.
Thank you very much for your introduction, Darren, and it's my pleasure to be here as well. Just before we start, just pardon me, I'm getting over a little bit of a sore throat, so I might cough a little bit as we go through the presentation, so don't mind me if I do. In terms of the poll, the correct answer is actually inspect fish and wildlife habitat. So we, some of you may or may not have noticed, but we just recently changed the name of the program, where we added the word public in there. The program had been called Environmental Health for a long time, and there was always a little bit of confusion in terms of people thinking that the job was related to fish and wildlife habitat, but it's very much a public health job and a public health field. And so all of those other activities that were on the poll do apply to, you may end up doing that if you enter the field, except for the one where you inspect fish and wildlife. That's more environmental management rather than environmental public health. So environmental public health, if you want to think of it, is basically all aspects of public health other than human-to-human transmission. So if we're talking about a disease that you catch from other people directly, so if someone sneezes on you, etc., that kind of thing, or sexually transmitted infections, etc., those are public health, under the realm of public health nurses, so human-to-human transmission. But most other illnesses, such as what you might get from your food, your drinking water, the air, your living environment, etc., all of those fall under the purview of environmental public health. And so it's a very broad field that you'll discover. And I'll talk more about it as we go through the presentation. Next slide, please. Thank you, Darren.
Thank you, Dale. Oh. I'm just going to stop sharing and then re-share so we can watch a short video.
I'm Zach, I'm from Fraser Health.
Pleased to meet you. I want to show you around.
Perfect. So today, I'm doing an inspection here at this food processor. We'll be looking at making sure that sanitizers are available, that the staff are following proper hygiene practices, making sure that coolers and other cooking equipment is functioning properly. So there's a wide range of things that we are working towards to make sure that food safety and sanitation are being followed closely. So I love my job because every day is a new day. I enjoy seeing the collaboration with our health unit and seeing their successes, because when our operators are successful, we're successful.
environmental health program here at BCIT trains students to become environmental public health officers or inspectors. And in that capacity, we inspect water systems, restaurants, sewage disposal systems, pools and spas, and we even do tobacco control, making sure stores do not sell tobacco to minors.
I chose to come to BCIT because it is one of the few schools across Canada that offers the environmental health program. The instructors are all previous environmental health officers, and that's great because they can give us a lot of their knowledge and their experience in the field, and they make everything that we learn, they make it really applicable to the job.
Here at BCIT, we work you hard. 2 years worth of very intensive instructions, and we offer a 3-month practicum to all of our students, and so they get their training necessary to become a certified public health inspector after they're done with us.
So in the end of the day, it's about healthy communities. It makes me feel good that I've done my part. I'm a member of that community, and we get to do it together, and that makes me proud to do my job and be a public health inspector.
Yes, what's environmental health? So that video gives a pretty good overview of sort of the general duties that an environmental health officer typically does. But what it doesn't capture is a more traditional name for environmental health or public environmental health officers, as they're known here in BC, is public health inspectors. So your duties under the Public Health Act here in BC, but basically the same all across Canada, is all different aspects of public health. So it might be things like inquiries from the public, concerns members of the public may have, or if more recently, in the past couple of years with the pandemic. So if you, I'm sure everyone's followed the news and things like that over the past few years. And if you hear, here in BC, Dr. Bonnie Henry, our provincial medical health officer, on the news saying, oh, health officers are out and about doing this, or health officers are doing that, those health officers are our graduates. They are the environmental health officers. It may also be medical health officers, which are physicians, but there aren't that many medical health officers in the province. So most of the field work is done by environmental health officers. So really, it's basically all aspects of public health that are covered, other than those specific ones like childhood vaccinations and human-to-human sexually transmitted illnesses, etc., that the nurses deal with. Next page, please. So our program is a 2-year full-time Bachelor of Technology program. So we actually need to update this a little bit. We, again, just recently changed the name of the degree. The degree is now called a Bachelor's of Environmental Public Health. And that's just for clarity, for your benefit, the benefit of the students, because there was some confusion in terms of when people graduated and people said, what is this Bachelor's of Technology credential? So the credential has been renamed to Bachelor's of Environmental Public Health, but it's exactly the same credential. We have small class sizes. Currently we have a max of 26 students per class, and classes consist of lectures, of course, field trips, as well as plenty of labs where we discuss all of the solid theory-based knowledge as well as practical hands-on knowledge that you need going into the field. At the end of the program, you are sent on a 3-month practicum with one of the regional health authorities in BC. And we are actually the only program in Canada, the only environmental public health program in Canada that arranges for that practicum. So there are a few other programs in Canada, but those programs require you as a student to go out and find the practicum yourself. Sometimes that's possible, sometimes it isn't, and sometimes there's a delay. You require the practicum in order to complete your training and be eligible to sit for the certification exam with the Canadian Institute of Public Health Inspectors. And that certificate, the certificate in public health inspection Canada for Canada, is the certificate that allows you to practice as an environmental health officer all across Canada. So the credential is recognized Canada-wide, and there's opportunities to work overseas as well. There's some additional hoops to jump through, of course, but that opportunity is there, and some of our graduates do go on to do that as well. But the credential that this program enables you to go and take that certification exam, that enables you to work all across Canada. So that is a definite strength of our program, that we have that relationship with the health agencies to arrange the practicums for you. Next slide, please. So preferred qualities, so mature, practical, assertive. So as you can imagine, as a public health inspector or an environmental health officer, going out and about, dealing with individuals in the public every day on a day-to-day basis, it does require a certain level of maturity and people skills. So because most of the work is people to people, right? You aren't sitting in the office all day. You're going out, meeting operators, meeting members of the public. So having those skills, those soft skills to speak in public, to make judgment calls, to make those decisions on the spot is very important. And also have the ability to work independently and in teams. What that's referring to is on a day-to-day basis, environmental health officers or public health inspectors has a great deal of autonomy. So generally, when you're working as one, you'll be assigned a geographic area. So all the facilities in that area will fall under your jurisdiction or your responsibility. So you would be responsible for going out and doing those inspections at those various facilities, answering questions, complaints, etc. But you have control of your own schedule. You are the one making determinations of where should I go today, what's high priority, what's low priority, etc. So that is a great deal of independence. You normally don't have someone looking over your shoulder. You manage your own timetable. The expectation is, of course, that you get your work done at the end of a certain period of time. And you do collaborate with other health inspectors on projects. You have to collaborate with other agencies, so such as the provincial government, with local governments, municipalities, bylaw officers, etc., fire, etc., for all kinds of different things. Being able to function on the full spectrum of both very independent all the way to working in an integrated team is also very important. And we try to help you develop those skills in the program as well, because we, we do put you through a lot of group work, and some students don't necessarily like that as much, but it is definitely of benefit when you actually go out into the field. So, and then I sort of touched on this already, the good interpersonal and communication skill. I would say 80 to 90% of the job is dealing with people. So most of the things that environmental health deals with in terms of the technical aspects, in terms of the scientific aspects, they are pretty simple. Not necessarily easy, I want to say, but simple, straightforward. It doesn't require a lot of know how to understand what's going on. We're not dealing with theoretical physics here. However, the tricky part is convincing somebody to do the right thing. So if you're working with a restaurant operator, how do you get them to do the right thing? If you're working with somebody who is upset and wants to lodge a complaint, how do you communicate with that person in a constructive manner, etc., right? So those are really the main challenges of the job. And so having some of those foundational skills really help a lot. Of course, you will develop those skills as you mature into the job, but it's a strength to come into this program with those skills in hand already. And then finally, good problem solving and decision making skills. And that's, of course, referring to those judgment calls I mentioned. So as you can imagine, when you're out in the field, you will encounter all kinds of different situations. So being able to know when is the time to take action, when is the time to exercise a little bit of this discretion, and when is the time to not do anything is actually very important. And so that goes hand in hand with that independence I mentioned before. You have a lot of discretion. You have a lot of powers actually as a environmental health officer under the Public Health Act to take action. However, the employers don't want somebody running around slapping tickets on everybody because that's not productive. No one's happy. It actually creates more work for you. But so, you have to recognize when is the time to issue that ticket or that order, and when's the time just to work with somebody, to educate somebody so that they know how to do the right thing, so that they will make those right decisions for themselves. Next slide, please. So benefits of an EHO career. So it is definitely a very diverse, interesting job, especially if you work in a rural area. And what I mean by that is, so sort of that video mentioned that your water systems, food, sewage, communicable diseases, everything. When you are working in a more rural area, you will tend to encounter all aspects of the job. And you actually become sort of a pretty I don't want to say important, but you become an integral member of a community when you're out there because you're the public health person. If you're working in a big city, then it's people are a little bit more specialized. You tend to have things like water specialists, communicable disease specialists, land use specialists, etc. So your day-to-day job may not be as diverse as it could be, but you will get that diversity in a rural job. However, when you first graduate, you necessarily won't specialize right away, but graduating from the program will allow you to sort of go down one of those paths if you want to do that as you mature into your career. Another benefit of the career is that you will work with people and members of the public a lot. You'll meet all kinds of different people. Some of them you might prefer having not met, but you'll definitely meet all kinds of interesting characters while you're out there, and you're not stuck behind a desk, which is quite important. A lot of people coming into this program, especially from existing science degrees, you've been in the lab or you've been in some sort of behind the desk job, and people realize that's not for them. They want to be out and about, and you will definitely get that when you are in this career. You will definitely be out and about until such time as you want to maybe take on more of a leadership role or a consultant type role where you may move behind the desk afterwards. You are definitely of a benefit to the community because you are out there serving the benefit of the community, right? You are doing your best to ensure that members of the public are protected and that everybody is trying to do the right thing so that they're not causing diseases or illness out there. So if you want to have a career where you feel fulfilled in terms of, yes, I am doing something of a benefit to the community, this is definitely one of those careers. You will get to apply your science background. So I sort of touched on this. This is a applied science career where you are taking the principles that you learned in undergraduate degrees, etc., and applying to the field. So what do those, the pHs that you learned about, what do they actually mean day to day, temperatures, etc. So you will definitely be applying your microbiology, your chemistry background information in a day-to-day job. May not be very high level, but definitely applied. I already touched on working outside of the office. It could range from anywhere from, you're going into a mall and going to the food court and visiting all the restaurants there, all the way to, and this is what I did when I was in the field sometimes, was driving out into the woods basically for a few hours to visit a remote mining camp, because the miners, the workers there need to have their food and water inspected as well, right? So highly diverse range of out of the office, quote unquote, type position, all the way to a fancy ski chalet will fly you in on their helicopter because their kitchen in the chalet needs an inspection, sort of thing. So again, very diverse. And then finally, responsibility. I already touched on this. You are independent. You're responsible for your own actions and for your own duties, and you have that discretion. So if you enjoy a certain degree of independence while on the job and not having someone to look over your shoulder, this is definitely one of those careers for you. Next slide, please. So employment. And so EHOs is the shorthand for environmental health officers. Excuse me. both federal, provincial, and First Nations health agencies all hire environmental health officers. So in BC, most of the jobs lay with the regional health authorities. So places like Vancouver Coastal Health, Fraser Health, Interior Health, Northern Health, Island Health, etc. And they hire the bulk of the environmental health officers or public health inspectors. The Health Canada and the federal government also hires health inspectors for places like cruise ships, trains, airplanes, airports, places under federal jurisdictions, and also First Nations on reserve. In BC, we have the First Nations Health Authority, which has taken on that responsibility from the federal government, but it's really the very same, similar type role. It's basically environmental health on reserve. There are also specialist type positions, such as with the Food Inspection Agency of Canada, Canadian Food Inspection Agency of Canada, etc. And PHAC is the Public Health Agency of Canada, and Health Canada. They're the ones dealing with, such as recently with the COVID pandemic. PHAC was sort of at the forefront of health officers at the borders, checking on people crossing the borders or at the airports, etc. So they are also a source of employment as well. The Canadian Food Inspection Agency are the ones going out to food processing plants, big food processing plants, slaughterhouses, etc. And they're looking after the food supply more specifically. So depending on your interests, some of our graduates end up there as well, because there's quite a bit of crossover there. Yeah, some people do end up in private industry as quality control or quality assurance places for food processors, grocery stores, restaurant chains, etc. So big chains like Loblaws or Overweighty, etc., will have their internal quality assurance people to make sure their stores are in compliance. Or sometimes there are private consulting firms. So big chains like Starbucks, etc., will hire a third-party consultant for inspectors to come and inspect their restaurants to ensure their restaurants are doing a good job. And so those private consulting firms do hire our graduates as well to serve as those private consultants. And then health promotion education positions for health agencies, etc. Those are sort of jobs out once you stepped away from the field, right? Once you're in the field for a while, but you want to do something different, you might do something in relation to health promotion. So it might be promoting public health to the public. It might be developing promotional material, etc. So there is a great deal of diversity when it comes to those types of positions as well. And those do exist. They're probably not necessarily entry level, but it's definitely a direction you could take your career in if that's what you were interested in. Next slide, please. So this is Zach here. He is one of the graduates. I think he graduated in, I want to say 2013. So this is his testimonial. He says, as an alum of the BCIT Environmental Health Program, I currently work as environmental health officer for Fraser Health. He was working in Burnaby, I believe, and I'm currently working to keep local restaurants, PSCs or personal service establishments, and pools in my district up to date with the ever-evolving COVID-19 pandemic information. So when his son was born, he took 2 weeks off to be with him and his wife, but he's now back at work in this rapidly changing time. So his colleagues were redeployed to the contact tracing hub, so case and management contact hub, to assist with contact tracing of COVID-19. There was a change in hours and duties, but now he's back. So he said, be smart, be safe, and he hopes he won't be calling you anytime soon. So yeah, so Zach was was nice enough to provide that testimonial for us. So glad to have that from him. So, and he's an alumni of the program. I'm actually alumni of the program myself, so I could probably be my own testimonial as well. I graduated from the program. I went and worked in the field for 8 years prior to coming back to BCIT to teach after getting my master's. And so that is also a career path as well, right? The most of our faculty members are graduates of the program at one time or another. Most of the environmental health officers or public health inspectors working in BC are graduates of the program. Some of them do come from out of the province, and we don't hold that against them, but most of them are graduates of the program as well. Next slide, please. Oh, admissions.
Thanks, Dale. So I can take over for here. You can rest your voice. And thank you so much. And we'll get back to you just after my admissions information for the Q&A session. Thank you very much. And now I will be reviewing with you the entrance requirements and admissions process, along with briefly discussing some key student services that are available to you at BCIT. The Environmental Public Health Program, there's one intake per year, and the applications are accepted online each year from October 1st until the program fills. And this does not mean you should wait until closer to the start date to apply. No time like the present. There are limited seats available. Therefore, it is beneficial to apply early. And the application steps, first for filling out the online application, it's relatively straightforward. Once the application opens for each cycle, you can log in and review the online application. You can work on filling out the application at your own pace. It does not go to admissions until you pay the application fee. Regarding the application process, you'll first review all entrance requirements. You can find those on the program webpage and the application processing dates. You will then upgrade if necessary, and BCIT does offer courses to meet some of the requirements in part-time studies, which is now flexible learning, and program advising can assist you with information on that. Ensure that you apply online, or when you apply online, that all of your required documents and as transcripts ready to scan and upload as PDF files. BCIT.ca/admission will guide you through the step-by-step application process. Once you are ready to apply online, you can visit bcit.ca/apply. And the application fee for domestic students is 90 Canadian dollars and 154 Canadian dollars for international students. I'm not sure if that applies to Dale, but he can straighten me out after, or if Janice is here, she can. Okay, the minimum academic entrance requirements for this program are as follows. Proficiency in speaking and listening, 2 years of full-time education in English or English-speaking country or equivalent tests and courses. 3 credits of post-secondary English or humanities or social sciences. 60 post-secondary credits. That includes, sorry, I'm not allowed to scroll. A biology, chemistry, and a minimum of 6 additional credits of science. And for non-academic requirements, there's a self-assessment form, and it requires a career discussion with a public health inspector or environmental health officer, a minimum of 1 year of full-time or accumulated part-time relevant work or volunteer experience, and a valid driver's license. You will require to have access to a vehicle. A class 5 full driver's license is preferred, and a class 7 novice license is the minimum for the practicum in level B. That looks like an 8. But that may not be adequate for all practicum locations. So as mentioned, as part of the online application, you will need to upload documents for a timely assessment to be completed. You can download official digital transcripts, or you can convert your transcripts and documents to PDF files. Information on how to convert your documents to PDF files is available on our website. For example, you can scan or take pictures of your official transcripts and save them as PDF files. And please ensure you upload all required documents to minimize delays in the application process. Then after you apply, your application will be reviewed by the admissions department to ensure you fulfill all the entrance requirements. And this process can take up to 4 weeks. Entry into this program is on a first qualified basis. This means if you meet the requirements and a seat is available, you will be offered a seat. Once you are offered a seat, you will be asked to pay a commitment fee to hold your seat, and tuition for the first term will be due 60 days before the start of classes. And the commitment fee is $500 for domestic and $3,000 for international. For laddering opportunities, graduate degree at UBC in occupational and environmental hygiene and Master of Public Health. You can get a graduate degrees at SFU and opportunities in epidemiology and health promotion, Masters in Education and Masters in Global Health. Now moving from the academics, I would like to let you know BCIT is committed to supporting students in a holistic sense. We want you to succeed not only in your academics, but also outside of school. Some of student services available to you as a prospective student, and others are available to you once you become an enrolled student. And here are some important student supports that I'd like to mention. If you are Indigenous, BCIT's Indigenous Initiatives Department is there for you to ensure a smooth transition into your first year. They offer peer-to-peer mentorship, a welcoming gathering place, and provide clarification on Indigenous funding. BCIT's awards, scholarships, and bursaries are listed on the Financial Aid and Awards webpage. I would like to mention that we have a President's Entrance Award, and selection is based on academic achievement, but also volunteer and community service. So please contact Financial Aid directly for more information on that. BCIT is committed to providing assistance to students with permanent or temporary disabilities. So if you have been accepted to a program and believe you may need accommodation to be successful, I encourage you to connect with our Accessibility Services Department. BCIT's Student Health Services is a health clinic located on the Burnaby campus. They provide medical care for current BCIT students all year round. And we also have a counseling and student development department available to help you enhance your educational performance and maximize your success as a student at BCIT. And last but not least, our recreational services promotes, encourages, and enables the practice of physical well-being. And we consider recreation an integral part of campus life and welcome all students to enjoy their services. And I should mention, if you have any questions after today, I encourage you to connect with program advising. And they're available via telephone, email, and Zoom appointment. Please go to the webpage at bcit.ca/advising for their up-to-date contact information and service hours. And I should mention, if your inquiry is time sensitive, please call for assistance because the phone would be the quickest way to get a fast answer. And these are our School of Health Sciences social media handles. You won't need to write these down because everyone will be sent a copy of this slide deck and link to the video recording sometime next week. And so you can also get the information from that. We just want to let you know we'd love to connect with you on Facebook, Twitter, Instagram, YouTube, and LinkedIn. And that brings us down to the questions and answers. So there's nothing in the chat right now, but if anyone has any questions, please feel free or comments to put them in the chat, and we will do our best to answer them. Here we go from Esther. For someone with family and who may not be considering a relocation, is there a possibility to get a practicum location in the Lower Mainland area, for example, the Fraser Valley, and possibly being hired after the program?
So the process for the determining where practicum positions, it's a two-step process. First is the health authorities generally hold some sort of selection process. So they basically invite some of our students to apply to their health authorities. So then they're picking who they want, right? So that is generally around, I want to say 20 to 30% of the practicum positions are taken up that way. So Fraser Health and Vancouver Coastal Health generally pick 2 students each went through that process. Then similarly with Island Health, Interior Health, they will pick some people as well, Northern Health, etc. Then the remainder students go into a ranked randomized draw. So what that happens there is you will make your choices of where you would like to go first, and then we draw people's names randomly. So depending on where you're drawn, you will get your highest choice that is still available. So if you're drawn relatively early on, you'll probably get your highest choice. I would say maybe like 50% of people end up with their highest choice. But then if you're drawn sort of near the end of the process, you might have just to go somewhere wherever, a spot is available, unfortunately. And so that is how that system works. So you cannot be guaranteed that you'll get where you want to go, but that is you do have some degree of control. In terms of possibility of getting hired after the program, that is sort of up to you, basically, right? Depends on how well you do on your practicum, depends on, whether or not there's any opportunities available at the health authority at the time. That does happen, and it happens that does happen on a semi-regular basis, actually. But again, it really depends on what's available at the health authority, what their needs are, and how well you do. Some people who really impress the health authorities, they will find a way to go out of their way to create a position to hire that person. And some people, unfortunately, if they don't, do as well on their practicum, then that won't happen. So it really depends on your own performance as well as the needs. And so I can't give a definite answer on that, unfortunately. I hope that answers your question.
Thank you, Dale. That sounds great. I'm looking for more questions from anybody. We're just about out of time, but I just wanted to give a couple minutes in case if anyone has any thoughts or questions. But if not, or if you think of something a little later, I'll just put up 2 important emails. Here's Dale's number for program-specific questions or concerns that you have, and program advising pretty much for everything else, for admissions and all those questions.
Like some people often send me questions in regards to their, their own credentials, etc. And some oftentimes I can't give a direct answer. Those questions are better directed to program advising. But if you have questions in regards to the program specifically, like the practicums, etc., I'm the best person to ask.
Excellent. Thank you, Dale. Okay, well, I think that is our time, and we're gonna wrap it up. I just want to thank everyone for being with us today and wish you all the best.
Thank you, Darren, and thank you everybody for attending.
Yeah, thank you, Dale, and everyone for attending, and hopefully we'll see you in the future.